Welcome to the New Dentist Study Club podcast. My name is Dr. Sanj Mohanta. We're going to learn about clinical management, practice management, and the emotional management of dentistry. Let's learn how to be happier in dentistry. Let's go. Thank you to our sponsors, Altum Dental Lab Group and RDT Dental Lab in Toronto. Hello, my friends. Thank you so much for joining us on this very special episode again. So grateful to all of you. We have a very special episode because it's the first time we have dental hygienists on and the first time we have two guests on. So I am thrilled that I have my friends Sianna and Kendra. They are on Instagram at Dental Toothy. And there are two things I want you to get out of this. First is how to do better recall exams, and two is how to have better relationships with your hygienists. So, first of all, Sianna, please introduce yourself.
Hi. Hi. Well, my name's Sianna. I've been out of hygiene for about 3 years now, or working in the field for about 3 years as a hygienist. But I started back in 2018, right out of high school. And then Kendra and I started our dental account in, I think, second or third year of dental hygiene, and it just kind of like took off from there.
Oh, I like that you two start off as friends and you're doing like a lot of like duet Instagram things. It's so much fun to watch. You're so entertaining. Especially
Yeah.
you, Kendra. I could tell like you have a dramatic side to you. So Kendra, tell us about yourself.
Okay, well, my name is Kendra. I'm also a dental hygienist. I've wanted to be a dental hygienist like since grade 8. I've always wanted to be a dental hygienist. It's always been a dream for me. Me and Sienna did school together, and then I've always, I guess, just had this funny side of me, and I've also wanted to do social media for so long. So when Sienna said, "Let's start an account together," I was like, yes, I can finally like express like all my humor that I can. And it just kind of went from there. So yeah.
Well, thanks for entertaining us on your Instagram account. And this is also going to be entertaining because what inspired me to do this episode was a video that both of you did on the annoying things that dentists do. For example, like tell the same joke over and over again. And
Yeah.
the other the other thing that inspired me was there was a dental student at University of Toronto, and he's like, Sanj, what are we supposed to do during recall exams? And I was like, oh yeah, they don't like teach us that in school. So I thought like who better to teach everyone but dental toothy. So who
Yeah, that's
wants to yeah, so I'd like to ask both of you, Sienna and Kendra, what is your ideal recall exam from the dentist side? Sienna, tell us.
The quicker the better. Yeah, I mean, ideally, like 5 to 10 minutes, about there. They usually just come in and I let them know, like, any findings, that we updated X-rays or when the last time their X-rays were. Um, and yeah, they take a look. I usually do occlusion and all of that myself, so that is one less thing that they have to do. Usually they do like a quick oral cancer screening just to like confirm that there weren't any findings that I found. Um, and then yeah, they just kind of check the occlusals, the buccal pits, lingual pits, and then it's pretty quick and easy from there.
Okay, great, Sienna. So I like the fact that you said quick. Okay, how
Yeah.
about you, Kendra?
I
Okay,
also
good.
have to say quick is good, but obviously so is being thorough. I've worked with some dentists where they like me to point out any areas that I see are suspicious, just write them down so that they can go over them. Obviously, keeping the x-rays on the screen based on the quad that they're looking in is also super helpful. But I would say oral cancer screenings are also super important. My dentist does that all the time, and I love that she does that because I have worked with dentists where they've just like barely looked at their mouth and they're like, okay, you're good to go. So that like even like TMJ, if you have time for that as well, maybe when you're looking in the patient's mouth and you can kind of notice that the patient's uncomfortable when they're holding their mouth open, stuff like that is also important to take care of. One thing I will say is if we're close on time and you ask us to take a PA before the next appointment, I probably will have a tear coming out of my eye, but other than that, I mean, obviously patient care is super important. Obviously, if the assistant can take it and like, one of your extra obs or something, that's super helpful, but not everyone has access to like another operatory or something. So yeah.
Oh, and I like what both of you do is that you do things to make our recall exam faster. For example, you're already writing down occlusion. You already have the x-rays up. If you notice we're working quad one, you're putting the quad one x-rays up. That is super helpful. And that you're pointing out things that you've noticed.
Mhm.
Otherwise, like I'm doing the whole exam, taking my gloves off, and then the hygienist is like, "Oh, did you see the 1/6 distal?" And I'm like, "Oh." And then
I also like giving, like Sienna said, like a brief rundown to like what the appointment is. So today's patient's in for a recall. Last time they were in was 6 months ago. Today we updated their perio. This is the difference from their charting from their last visit to this visit. Um, just like stuff like that. I also mentioned.
that's really helpful because I've worked with some hygienists who don't say anything at all. And so I
Yeah.
have no idea if they've improved. I'm asking the exact same questions that the hygienist asked, so that's
Mhm.
wasting time as well.
Yeah, it's
And
a
how
team
about,
effort.
yeah, like do you have a preference of when the dentists go in the middle, in the beginning, the end? Does it really matter? Or is it like depending on our schedule, whenever we can come in, we can do it?
Yeah, I feel like for the most part, they come in at the end of the appointment, but
Okay.
honestly, like, whenever works for you guys to, like, keep the flow going in the office so that we're not sitting around waiting. Like, if you have time between patients and you have time to do a recall exam, you might as well just pop in and do it.
Okay. And then how about writing notes for recall exams? Do you write the notes for the dentist, or do you prefer that the dentist kind of just goes on their own and writes the notes?
I write my own notes just at the bottom of the note I'm already writing. I'll just put like
Okay.
DBS findings and I'll put like
Okay.
any decay, watches, extractions, referrals, like if there's any like bridges or crowns that are recommended,
Okay.
anything like that, just to speed the process along.
And Kendra?
Yeah, I pretty much do the same thing. For me, I try to so it makes everything easier. I'll try to treatment plan and add in the odontogram, let's say they have decay, just so it's easier for front desk and for the dentist to see as well. So sometimes if they're a lot, I'll just quickly, briefly go over is like confirming like this is what you said, um, just to make sure everything was put in correctly. And then I'll do the same thing. I put everything at the bottom of my notes, and usually I'll put in quotations what the dentist spoke about with the patient, just so if we ever have to look back on anything like why did we recommend a sealant for this tooth or something like that, then that's super helpful because there's been times where I've added in a note of like, oh, we recommended this for this, and I'm like, well, why did we recommend it? Like, I know it's
Yeah.
usually like common sense, but every patient it's different. So
Yeah, that's true. Patient specific.
mhm.
And how do you feel about things when there's like a difference of opinion? For example, you might say like, "Oh, I think you should check the 4/6 occlusal," and the dentist is like, "Yeah, that's fine." And you're thinking, "Okay, clearly that needs treatment." How do you handle that?
Um, I mean, we're both, at least for me personally, we're still pretty fairly new to the field. I am comfortable with asking my dentist personally. There has been dentists I have worked with where, I mean, obviously we can't diagnose anything,
Yeah.
and I've wanted to say like, maybe look again, but I don't know. I personally like if I'll do it with my own dentist, but personally in the past I have let it go just because
Okay.
at the end of the day, like dentists are basically what I'm saying is there are dentists I've worked with, they're like, "You're the hygienist, you can't," you know?
Oh, that's too bad.
Yeah. But my dentist now is great, so I don't have a
Okay, that's
problem with
good.
her now, but
That's good.
yeah.
I guess, find an office where you share similar treatment philosophies.
Yeah, that is super important, yeah.
And how about you, Sienna? What do you do in those situations?
Um, I definitely agree. I think working in an office that you and the dentist both have a similar treatment philosophy is very helpful. I mean, I just kind of let it go at the end of the day. Like they're the dentist, they can treatment plan what they want. But maybe I'll like throw a watch on the odontogram just so we can check it again next time.
Good. And then how about things like radiographs? Do you prefer that the dentist comes in and takes a look first and says, these are the x-rays you need to take? Or do you prefer that there's like, which is ideal? Or because what I do is at the end of my notes is I'll say, okay, next visit, recall into bite wing. So that way the hygienist know it's already been treatment planned, and the hygienist can do the 2 bite wings next time without me having to take a look. But I work at offices where sometimes I don't agree with the X-ray protocol. For example, they'll say things like, take a Panorax on every new patient, take a Panorax every 5 years, do 4 bite wings on every patient, even though they might be missing teeth. Like, how do you handle that?
So for me
Um,
personally, I'll ask my dentist. Usually when I'm going over, like, let's say it's a new patient, and like you said, most standard exams call for bite wings and a Panorex. Obviously, if they don't have teeth in the back, which is usually what we kind of discuss at the beginning of the appointment, like when I ask if they have dentures or not, then I'll usually go up to my dentist and ask, do you prefer for me to do this? What do you prefer for me to do? But it's the same thing in the mornings as well with my patients that I see on the regular, like 9 months, 6 months, or whenever they're due to take X-rays. I prefer to ask my dentist what she prefers for me to take, just because they're the ones prescribing it at the end of the day. Um, but for the most part, she does trust me if I do need to take an X-ray or something. She's like, I agree with you, but generally is pretty much just asking before we take it.
Okay, good.
Yeah.
How about you, Sianna?
Yeah, about the same thing. At my office, we usually take about every 12 months or so. Will
Okay.
update bite wings. So it's like pretty standard across the board, but it's also patient specific. Like again, if they don't have back teeth, you're not going to take bite wings.
Yeah.
So then I'll just ask like, oh, do you prefer like a PA of these teeth or whatever the case.
Oh, that's good. I like how you say that because we're so used to just saying, yeah, take bite wings. So, we love it when hygienists say things like, oh, would you rather have a PA? Because there's only one tooth in that quadrant. Yeah. So yeah,
Yeah.
we like to get help from you guys as well because you know the patient's best.
Yeah, I noticed too, like when I take pans, I always take a look before I start working on my patient. And if I see anything suspicious, like, a periapical radiolucency, I'll be like, oh, do you want a PA of this tooth? Because I'm seeing something on the pan. And
Oh,
then it
good.
kind of just like saves time. So when they do come in for the recall, the pan or the PA is already taken and they don't have to be like, oh, can you get a PA? And that's kind of helpful too.
Okay. So how do you like we know our patients for a long time. They come in there, we get really chatty, start talking about vacations. So how do you feel about that?
um, I mean, if you're quick about it, it's nice to catch up and, like, for patients to feel comfortable with you,
Yes.
for sure, but, I mean, in moderation.
So how sometimes we don't know like okay if you're running behind or not. So what is something you can tell us to speed us up so but then do it in a diplomatic way?
Pull up the schedule. That's what I do. I pull up the schedule and I start looking at the
And
time.
you point to it.
That's what I do. That was like
Okay. Or I guess for those, sometimes it's the patients who are really chatty who want to talk to the dentist. So maybe in those cases, like, be like, okay, it's time for your exam now. How about we put you in the other room? And then the doctor's going to come because you know that they're going to have like a full on 30-minute conversation. Especially when they start
Yeah,
like
Yeah.
showing, taking up their phone and showing pictures. And
Mhm. I've done that. I've moved patients to other rooms, like,
okay.
if I know the dentist is, like, in a procedure where they can't leave or something, I'll move them into the other room.
Okay, so sometimes the hygienist will come to my room and say, okay, it's time for a recall. And they can tell I'm very stressed out. Like I'm in a
Mhm.
really like stressful situation where, for example, I'm not taking the tooth out or the patient's like very anxious. And then so and I'm like, yeah, fine, I'll come in for your recall, like basically yelling at you. So what can we do in those situations? Like, is it better just for us to say, hey, how about we bring the patient back another day? Or like how do you handle those situations where you're even afraid to knock on our door?
I think if the dentist tells you to move it to another room, that would be super helpful. I've definitely done that in the past, just to kind of stay on schedule and not fall too far behind. Um, So I think like some teamwork and communication is always good. We also have like a texting system in the office, so we're
Okay.
able to message back and forth. So if someone's running behind, they can just shoot us a text as well instead of leaving the room, which is helpful.
Okay. Okay, that's good.
Yeah.
How about you, Kendra? Any other tips?
Yeah, I think it's difficult when you guys are stressed out because I do understand it. I think it stresses us out when you guys get a little bit like, "I'll be there in a minute." Like, I think that's when we're like, "Oh my god." So obviously, if we get behind in our appointments, it stresses us out too because it looks like it's us who's late
Yeah.
instead of you know what I mean? So I feel like Sienna said, doing the whole communications thing, and even I feel like this could be mentioned at the beginning of the day if your office does like a
Mhm.
huddle, or maybe when you're reviewing, doing your chart audits in the morning, you say, "Hey, I noticed you have this today," and just kind of game plan how you guys can make
Yeah.
that work. Like maybe at the start of this appointment, you can come in or whenever you feel that you have a time. I understand you guys got like a whole
Mhm.
lot going on your mind, so it's probably like
Yeah.
it might slip your mind, but yeah, I think what she said is communication is the biggest thing.
Yeah, good. And even have like some code words because sometimes you
Yeah,
don't want to talk about
yeah.
everything that's happening right in front of the patient, or you don't want your patient to know that you're leaving to do a recall. So
Mhm.
it can, so code words for, move the patient to another room, or another
Yeah.
code word for, rebook the patient. I'm way behind. I'm too stressed out. I can't do a recall right now.
Yeah. Yeah,
Yeah,
be
that's
a great
helpful.
idea.
Mhm.
Okay, so we talked about the recall exam. How about better communication between dentist and hygienist? What are your tips on that? Because we don't totally understand your concerns. And then sometimes we feel like, oh, the hygienists find the worst time to come and ask for a recall. So, Kendra, how
Um,
about you start? What's some tips for better communication?
Um, I would say, I guess just the huddle at the beginning of the day would probably be the biggest thing. Going over everyone's charts together. Um, or yeah, that's like my best idea of how because I'm still trying to brainstorm this myself of how you can make that communication better. But I think, in my opinion, the huddle at the beginning of the day and going over
Okay.
your charts together would probably be most ideal.
Yeah, the huddle's so important. So many offices I've worked at don't do a huddle.
Yeah, me too. Yeah.
And then it's not just going over what's going to happen that day. It's also like quickly reviewing what happened yesterday instead of like problems building up and then you're waiting for the monthly or quarterly team meeting.
hmm
mhm.
Yeah, it's nice. So basically a morning huddle for, I guess, anyone who doesn't know, basically the whole team meets together. So like your receptionist, the assistant, the dentist, whoever else you have on your team, and you're basically going over the whole schedule. So the dentist explains what their day is looking like. I'm explaining my day looks like. Maybe my patient's coming in and they have some kind of medical condition that we have to discuss if it's okay to do treatment or not. It'd be a great time to discuss. Do you want me to take x-rays on this patient? Or even like we mentioned before, hey, you have like a 4 hour extraction. How do you want to do this? Is this a good time to do like a recall? Should I just do like a scale? Like something like that. Yeah.
Okay,
So
good.
those are super helpful at the beginning of the day, but I agree. There isn't a lot of offices that do them. That definitely, it does, even if you can take like 10 minutes before your day starts, it is very helpful.
Good. And like we are recording this episode right before Super Bowl. And I'm gonna do like in sports, they do huddles, they do game plans,
Mm,
and that's how you get your wins. So, dental offices should do the same thing.
yeah, 100%.
Okay,
Yeah, when I
Sianna.
used
Go ahead, Kendra.
No, I was gonna say, like, when I used to co-op when I was in high school, like, at a bunch of different dental offices, like, everywhere I went, like, this was, like, it was, like, over 5 years ago now, it was a long time ago, but I just remember everywhere I went, they had them, and I rarely see them anymore. As my time of being an assistant to a hygienist, I think there's been, like my old office I used to work at used to do it sometimes, and that was it.
Oh, that's sad. We have
Yeah.
to have a revival of the
Mhm.
huddle.
We're gonna start a movement.
How about you, Sienna? Any tips for better communication?
I mean, I think the huddle's the main thing I would say. It helps you look at the day as a full picture and not just your column, because I think people might be, like, hyper fixed on their column and what's going on in their
Yes.
schedule, and when you have a meeting and you're like, "Oh, like, this is also what's going on with everyone else," like, and everyone's gonna be very busy, and it helps you pre-plan a little bit more instead of just going in a little blind.
Yeah.
So I think that helps as well. And then just, like, when you work with a dentist for a while, you just kinda get in a groove with each other. So, I've been lucky enough to have some good dentists that I've worked with, and yeah, you just kinda get in a groove after a while.
Mhm. So how about those new associates who don't have that groove yet? So what tips do you have for a new associate that comes in the office and how they can work better with the hygienist, do faster recalls? What tips do you have? Sienna, you can go first.
Um, I mean, they're probably a little slower or don't have, like, as many patients if they're a new associate, so maybe talking to them before they go into the room for the recall and giving them the rundown, like, without the patient in the room and just kind of telling them
Okay.
all your findings and the X-rays and any of their concerns so that they kind of go in, with, like, a full picture of what they're walking into, just to feel more prepared. Um, and I think, like my friends have said, like, the main things that they look for is, like, occlusal, on the occlusal buccal pits, lingual pits, kinda like the obvious things, and that kinda helps
Okay.
kind of move things along.
How about you, Kendra? What tips do you have for new dental associates?
I would say talk to the hygienist first, talk about what you would expect to see, and then versus, like, what, they break down an appointment usually, and then kinda work together about how to run down the patient information together and to be the most quickest and efficient with it. So like Sienna said, breaking down the information before you go into the room was super helpful. Probably gives them some time to kind of like understand it and I digest it. And then even if the pressure of feeling like you need to be fast, like we were there once too, it's stressful. I feel like even because like Sienna said, they probably aren't super busy. You can even move them into another op so that they have more time to kind of go over everything. But even just explain to each other step by step, okay, start by looking at the x-rays. Like if you have downtime and I just started my recall exam, let's say you prefer to go in after that you're done the cleanings and everything. Look at the x-rays before I come to get you, or even their medical history or their charting and stuff like that, just to kind of understand the patient a little bit better. Um, but yeah, I think just discussing what the both of you would find to be the most productive and efficient together, I think that's a really good way to approach it.
Oh, that's a really good idea for dentists to look at the chart before they go into the recall exam for a patient they never met before,
Mhm,
because you need to, like you said, you need to know about their medical history, what other dentists have recommended before, so that you can recommend the same thing. So you're not saying something conflicting, that you've already looked at the x-rays from, not just the most recent, but maybe past few x-rays so you can see what the changes are, like in bone levels, caries, patterns. So that way the patient trusts you more because they feel like you've really taken the time to know them when you say things like, "Oh, I've noticed that, your gums are getting healthier, that you have less decay, that you're improving with your oral hygiene. I've taken a look at your medical history. I can see that you're taking medications that are causing dry mouth. What are you doing for that?" And then the patients start to like really trust the dentist. So if the dentist recommends a treatment plan, the patient's going to be more likely to go with it.
mhm, exactly.
Okay, so now the juicy stuff. What's the stuff that you don't like about working in dental offices? For example, like I've heard from my dental hygiene friends, like instruments being dull, not having enough time. So let's talk about that and more besides those two things. But Kendra?
You kinda nailed it right on the head there. I've worked at some older offices, with super dull instruments, and, like, the thing is, not only I mean, I understand instruments are so expensive, but it also reduces patients' quality of care and then also the longevity of your hygienist as well. Um, my first practice I started at when I first started out hygiene, oh my god. I feel like that's why I'm having the problems that I am now. I used to have to push so hard with my instruments and even the
Oh,
Cabotrons, they were, like, basically useless because they were so dull, but, yeah, that's definitely one of them. I've worked at offices where they don't give you a lot of time for appointments, and those are really stressful because not only is it putting a lot of stress on you, but the patient notices it.
Yeah.
Or especially like when you say you have to do a recall exam, and the dentist needs to come in, but they're behind, it puts you even further behind.
Hmm.
Um, I've done like paper charting. I've worked with phosphor plate. Those are like, let me tell you, I worked at the office for like maybe a month and I was like, I can't do this. This was the same office that was like cutting my appointment times. And I was like, perio
Oh
charting on
gosh.
a paper chart, I couldn't do it. I was like, I gotta go find somewhere digital. So those are probably
Wow. And then you mentioned some of the problems you're having now. Do you mean like muscle and musculoskeletal issues?
yeah, sadly, yes. I think because of I when I first started, I was holding my instrument so tight and putting so much force, trying to remove tartar. And I think I'm suffering from it now. I've been having a lot of
Oh,
issues in my hand, and even like my upper back and stuff like that. So I've been trying a few different things and it's been helping, but like my wrist clicks all the time. Like it'll hurt after like my first
oh
patient.
no. And
Yeah.
you just started your career.
Yep. Yep.
Actually, hygienists have a higher rate than normal of musculoskeletal issues, having to retire early
Mm.
because of issues like that, having to, need chiropractors, massage therapy. Like I've had a hygienist who had to retire early because her shoulder and back hurt so much.
Yeah,
Ugh.
and the thing is, it's difficult too because patients don't understand that you do it for 8 hours, 9 hours a day, which you signed up for it. Like, I love
Mhm.
my job. Am I in pain? Yes, but I'm not I still love it. Um,
Yes.
but, it's simple things like asking your patient, "Can you tilt your chin up so you can see better?"
Mm.
But then most of the time, they keep putting their head down, or maybe you're pulling their cheek so you can see, and then they go
Yeah.
with you. It's like, "Oh my gosh." So I think patience, understanding that too can be difficult because you don't wanna keep repeating yourself.
Yeah.
But I didn't when I first started working, I just wanted to be really good at what I was doing, and I wasn't even focusing on my ergonomics, so I started
Hmm.
investing in it more in, like, the past year, and it's
Good.
been helping, but yeah, I'm still experiencing it. I'm trying different new things, so hopefully I'll have some good news sooner than
Yeah,
later.
because we want you to have a long career in dental
Mhm.
hygiene. And for
Yeah.
the dentist owners who are listening, like have great chairs for your dental hygienist and sharp instruments and good
Mhm.
lighting and have wheels that can swivel around and don't get stuck like in cracks in the floor, like things like that.
Yeah, it is super important, it is super important. Dentistry is so expensive, that's the unfortunate part,
Yes.
so, like, I do understand it so, so much, but it does take a really big toll on the hygienist,
Oh.
and they will appreciate you for it, I swear they will.
Okay, so from Kendra, we heard sharp instruments, enough time for the appointment, and also like ergonomics, like,
Mhm.
to so that way the hygienist isn't in pain, and also like not having 10-hour shifts. Because
Yeah, those
because
are
I work at
I don't know how I did it. I used to do that when I first graduated, and I was so burnt out. Oh my god, it was
yes,
insane. Yeah,
yeah, having shorter shifts,
it is
having
important.
and having breaks.
Mhm.
How
Time to get some water, please drink your water. Drink water.
about you, Sienna?
I mean, I feel like the most frustrating thing is just when instruments or like tools don't work, or like you go to use a slow speed and it's not spinning, and then you have to like take your gloves off and go get another one and like hope that one works. Or like when your Cabotron's like dripping down someone's face,
Oh,
like that's frustrating. It's like, oh, you just want your things to work like the first time. I think that's
it's
definitely
true,
like a
especially when
frustrating
you're on a
thing.
time crunch.
Yeah, sometimes you just like every minute counts. It definitely does.
And a lot of the things that you mentioned, those are the same issues that I have as well, like instruments not working, not having the best instruments, not having enough time. Like it just seems like we're running a marathon every single day. It's like go, 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 go. And at the end of the day, you're like, "Ah, I got
Mhm.
through it. Like
Yeah.
I really wish I know like dentistry is expensive, time is money, but it'd be so nice just to have like a little bit of buffer time to catch up, to
Yeah.
have time to go to the washroom, to drink some water. Because our patients will come in late and then they'll say, "Oh, can I go to the washroom?" And they'll stop
Yeah.
halfway through the appointment and they'll say things like, "Oh, can I have a drink? I need to
Mhm.
spit." And we do it for them, but then we're not doing it for us.
Yeah.
Yeah,
Yeah.
so we definitely have to take care of ourselves so we can have long careers, and we definitely have to like talk to each other. Otherwise, we're going to be frustrated at work. It's already a very demanding job, and we're all on the same team. So we all have to work together. Like just going back to, the football, you know, analogy, like they have like hand signals. They have, they are like tapping each other out and, calling someone in from the bench, like when they're too tired. Like, and we don't have that. But we can instill like all those things from sports into dentistry because we are a team.
Yeah, for sure. I feel like in school, they just tell you a lot about, like, your body's gonna hurt, it's very hard on the body, but they don't tell you, like, it's socially so draining and just, like, emotionally
Yeah.
draining. At the end of the day, I just, like, sit in my car and just, like, stare at the sky. I don't know, you just need time to, like, decompress, because it takes a lot out of you, for
Yeah,
sure.
because
It
you're
is demanding.
you're always being professional, on time. You're always focused on the patient. And at the end of the day, like you realize like I wasn't focused on my own needs the whole day and you're drained.
Yeah, it's exhausting. I definitely can see where burnout comes from, for sure.
But both of you have actually like when I'm stressed out, I go to your Instagram account because I always know it's going to be something funny.
Aw. You're so
Yeah, and you're always like so relatable. I'm like, yes, that's exactly how I felt today.
some stuff where, like, there's so many funny things you can think of, but it's like, I don't wanna step too close to that, so maybe not. 'Cause I just know I could have so many more funny videos, but I'm like, I just need to think of the other people watching, no.
Oh, I wish you could have like a private, like just send private videos, just to me even, and
I was
make
gonna
me
say, we'll
laugh.
make them just for you. Yeah, we'll
Thank you.
It's
make
funny it's funny seeing how it's like a universal experience, like, everyone has the same issues and the same problems, and it's fun making relatable videos, and then everyone, like, congregates in this comment section and and tells their
True.
stories of how they relate, it's fun.
It is. So tell us
Yeah.
how our audience can contact you. Sienna?
I mean, just through our Instagram,
Yeah.
Dental Toothy. We have a TikTok account as well,
Okay.
and, we have our, email linked in our Instagram bio too. If anyone, like, has any questions, they can DM us or email us, whatever's easier for them.
And you also have some talks coming up at dental conferences. So tell us
Oh,
about
yeah.
that.
There's one in Vancouver coming up in March, so that's fast approaching. And that's on oral systemic health. And then there's a talk at ASM, which is in May this year, I believe.
Yes.
And then there's one in Dallas in the summer, which is actually on my birthday. So it'll be my 25th birthday and I'll be presenting. So I'm excited.
Oh, so proud of you, Sienna. I can't wait to watch
Thanks.
you on stage.
Thanks. I'm so nervous, but it'll be good.
And how about you, Kendra? How can the audience contact you?
Same thing on Dental Toothy. I'm
Dental
always
too.
searching through our DMs and our comments and everything like that. That's probably the best way to contact us. Um, yeah.
And do you have anything coming up this year?
Not at the moment. We're working hard, with some little secretive things that we can't talk about right now, but, hopefully soon. As of conferences and talking, no, but that would be a really cool opportunity. If I had it, I would definitely take it up this year for sure.
Kendra, you should apply to be on stage, like Broadway.
Oh my gosh, my
Sienna should be
hairstylist
speaking at conferences and you should be acting. You're so
my
good.
hairstylist, she loves our Instagram, and her team finally started, doing social media, and she's like, "We need you to be, on one of the videos because, like, you just you know what to do, like, you know the whole social media thing." I don't know if you saw the video of me getting my hair done. Oh my god,
Yes,
it was so funny. Yeah,
I
everyone there was like, "Are you how do you do this?" And I'm like,
did.
I don't know. I was just born with it, I guess. I don't know. I do
Yeah,
love it
Ken
though. I love it a lot. If I could have a full day, my dream is I love hygiene so much, but if I can take like a day to do social media, I would do it. I love it.
Oh. That's great.
Yeah.
Thank you so
Yeah.
much for like being so creative, sharing content with us, sharing everything you learn with us as well, like with conferences and on TikTok and Instagram. We just love you so much. So thank you, Kendra and Sienna.
Oh,
Oh,
thank you
thank
so
you
much
so
for
much.
having us.
And thanks to the audience for listening. Till next time.
This podcast is sponsored by RDT Dental Laboratory, your full-service dental lab in Toronto. RDT Dental Lab will help you grow your practice through education, predictable restorations, and high attention to your clinical needs and patient experience. Check them out at rdtdentallab.com. Thank you for listening to the New Dentist Study Club podcast. Listen to us on Spotify, watch us on YouTube, share and subscribe, and follow us on Instagram at New Dentist Study Club.